Bill.
Yeah.
There are two cases you shared with me that illustrate two important parts of all of this. One of these had what you call a body block, and the other patient had an emotional block. So if we take the patient who had the body block,
Yeah.
let me tell you the background you gave me, reading here. You were in a group therapy back in the 1970s, and one of the group was a handsome, tanned, very muscular fellow, about 40. He sat slightly back from a semicircle of chairs, and when introducing himself, he was not unpleasant, but evinced little or no change in expression or voice tones, and spoke very concisely. We were all there to learn and share, but when he asked about any personal concerns he might have that he was willing to work on, he was evasive to the point of obstinacy. He was extremely muscular fit as he took off his shirt and lay down on a gym mat. They asked him to stretch out on
the
mat.
therapist, by the way, was Richard Erskine, who was a psychiatrist, psychotherapist from New York City.
Then I'm going to turn it over to you. This therapist started doing heel and thumb technique on the back.
Yeah.
And then what happened?
Well, he started to press on his back, and because the fellow was so rigid, and he couldn't get anywhere. The fellow was just strong. He didn't make a budge. So Richard asked him to take off his shirt and lay down. Well, here's this powerful guy laying on his belly, and Richard took off his shoes, his own shoes and socks, and had somebody balance him. And he started at the low part of his back, and with his feet, heels and toes, stood all of his weight on this fellow's back. And he slowly moved up and wedged his heels and toes and all of this pressure. And Erskine isn't a very big guy. He probably weighed 155, 60 pounds or something. But that's a lot of weight to be putting on a back. Anyhow.
He's standing on the guy's back.
Standing on the guy's back, all of his weight, and just balancing himself with somebody alongside. He got about halfway up his back, and suddenly the fellow yelled out, "You'll never make me cry! God damn it, you'll never make me cry!" And his voice tones changed, and here it was, it sounded like a little kid screaming. Anyhow, Richard got off of his back at that time and encouraged him to go into the feelings that he'd had. And he described to us his childhood, where he was the younger of 3 brothers, and the 2 older brothers persecuted him as a little kid and would tickle him unmercifully. So he had to steel himself against crying. And in order to protect himself, he developed purposely this strong, strong body, and it was almost as if he built a wall around himself. And all of his life, he had kept a wet blanket on any warm and soft feelings, and became rather stoic. His smiles were just brief like that, and he was a psychotherapist, but he hadn't had enough therapy to realize the emotions that he kept under a wet blanket. Anyway, he broke into, with questioning, all of his childhood and how he had steeled himself to be emotionally stoic and physically stoic.
So all of that was suppressed in childhood with those 2 brothers.
Suppressing.
And then when he got into adulthood, what then was he repressing? Joy?
He was repressing
warmth.
He was repressing any and all emotions, and especially was he repressing, suppressing fear, sadness, grief. He became not emotional. So he could talk about it, but he didn't feel it. Yeah.
Then did that therapy session alleviate?
Opened up his feelings, and from that point on, he was able and we were there to be therapized.
Right.
He was able to go on, and over a period of years that I knew him, really progressed a great way to almost healing. Yeah.
Okay, we're talking here about suppression in childhood and repression in adulthood of emotions. And that was a man who had what was called a body block.
A body block, yeah.
Which had formed out of the suppression of all.
He corralled in his body all of the thoughts and feelings that his mind couldn't handle.
Right. This next case is a little more complicated. This is one of your cases. A 65-year-old woman with Sjogren's disease. Sjogren's.
S-J-O-R-G.
Which is extremely dry mouth, dry eyes, no tearing of the eyes.
No tears and no saliva.
Yeah. And this goes back 7 or 8 years. I think she's 65 at the time you're describing her here. So you want to tell us about her and what led to where she is in life as an adult.
Yeah. Well, this is a brilliant woman who's well respected and well renowned, and actually counseling other people. And so I saw her because I'd known her socially, and she'd been interested in some of the other things that I'd done over the years. So she came in because she'd heard that I was interested in autoimmune disorders, and there are about 80 of them. Autoimmune meaning immune reactions towards the self, not non-self. Your hay fever is non-self. When you have autoimmune, you have something like rheumatoid arthritis or diabetes or lupus erythematosus. Various
the body
diseases.
Turns on itself and destroys, inflames,
attacks normal tissue as if it was a piece of ragweed.
Can't recognize self.
Right. Self from non-self.
Right.
Yeah. So anyhow, she wanted to talk about Sjogren's, which is an autoimmune disorder. So in talking with her, I prompted her to think back about feelings, about emotions, not touch feelings, but emotional content. So when we got to sadness and fear, of course she was right along my line because I came up the same way with a wet blanket on those emotions. Sure enough, she found out that all of her life she was teaching other people how to cope with their world, but at the same time had never allowed herself to have the emotions of sadness. And we went back into her childhood, as I had done years before with my own, and she found out that she was constantly protecting her mother. Even though Mom and Dad were very kind and all, but Dad was rather stoic and Mom was emotional. And in order to protect Mom from feeling upset with her tears, she stopped having them. And Dad was pleased because he was stoic and he handled all his feelings without much expression. So they never spanked her or anything, but they never dealt with the emotions of fear, sadness, or anything that would make a little kid cry. And it's an interesting rule, kind of call it a psychiatric rule of thumb, that mother will tell you what not to do, and Dad will show you how.
So mother's saying, don't do that.
So Mom,
and father turns around and does that, right? Yeah.
Don't do this, and the. Don't be afraid, this, that, and the other. And Dad will show you stoically how to succeed in that effort.
How does that come together like that? That this woman married to this man would feed that kind of?
I don't know
It just happens?
How it comes together, but when you look at couples, you'll find very often that that's exactly true. Mom will tell you how not to be, and Dad will show you exactly, because he's representative of how she wants you not to be. And there's always conflict between Mom and Dad. And she'll say, well, you know how your father is, and Dad will say, well, you know how your mother is. So that's interesting. So later in life, who do we marry?
Yeah, mother.
We marry our mother, and the girls marry their father.
Yeah.
So we find out within ourselves, and I use the expression that Richard Bach uses, a favorite author of mine, in the book Illusions. We teach best that which we most need to learn. We teach others and our children what we have never learned ourselves. So the freedom to have and experience all of our emotions should be a God-given right. But in society and dealing with one another, we put a wet blanket on the emotions, on one or more emotions.
Well then, what is normal?
Okay, well, I've said to you before and written it down a lot of times, the only truly healthy people I know are those I don't know very well. And that includes thee and me.
Yeah, I'll join that
So
group.
we're still learning how to be healthy.
Right. I think we're going to wrap up this session. I want to thank the viewers for seeing us. I do want to point out your books again. This book I think is particularly good, Visual Imagery. I have two books that are available through Amazon, Symptoms of Unknown Origin and Puzzling Symptoms. My experience in patients that had symptoms that were not due to definable medical diseases.
Which you and I agree on completely.
Right. And that we believe there's a lot of stuff out there. We believe that primary care is largely a psychologically oriented kinds of problems. Maybe 70% of first contact medical patients have more of a psychological problem than do a definable disease.
Yeah, I think that's right. A statistic I'd heard is that 80% of all the symptoms that come into the ordinary doctor's office are not diagnosable by laboratory procedure.
And with listening and psychotherapy disappearing, it's no wonder the healthcare bill has gone through the ceiling.
Exactly.
Because they've turned to technology.
Yep, and
prematurely.
Anymore doctors don't get paid for time, so they see you for 5 or 6 minutes.
Right.
And give you a set of pills. And the money goes up to here, and the health, we rank 25th amongst industrialized nations in the way of health.
In terms of, what's it called?
They brag about being well, but by gosh, we're not.
No. And to end the note, there's a thing called amenable deaths, those deaths that could be prevented by adequate medical care and prevention. We're 17th in the world in amenable death prevention.
Yeah. And yet we hypocritically brag about how great our healthcare system is, and in the politics of the present day, there are arguments that if we change our healthcare approach, that it's somehow not okay.
Yeah.
And yet our healthcare approach has proven to be lousy.
Yeah, go figure.
Yeah.
So we'll end on that.
Yeah.
That happy note, right?
Boy.